You guys save lives on the ward every single day. But what actually happens when those hospital doors close behind a patient? Welcome to this explainer. Today, we're diving into something that really gets to the heart of your daily work. We're going to unpack a really powerful lived experience perspective from author Andrew Turtle. He recently shared this profound look at the critical difference between surviving a psychiatric crisis and genuinely rebuilding a life. As medical professionals, you are always right there on the front lines of the crisis. But understanding what happens next, from the patient's internal point of view, well, that's absolutely vital if we want to provide truly holistic care. So here's our roadmap for today. We'll be moving through 5 main stages: surviving the clinical crisis, the limits of stabilization, defining long-term recovery, identity and self-determination, and finally, bridging treatment and recovery. Basically, we're shifting the lens from acute medical care to the long-term, self-determined milestones of holistic recovery. All right, let's jump right into part 1, surviving the clinical crisis and looking at the clinical foundation. Now, Andrew defines treatment exactly the way you do. It's that immediate, highly necessary intervention. Notice that treatment is inherently an active process that you perform upon or in collaboration with the patient. You step in, often during a severe, life-threatening episode like mania or psychosis, and the primary goal here is incredibly clear and urgent. Get the patient to a place of safety, manage any immediate risks, and restore their basic functioning. It is crisis management in its absolute purest form. And to get that crucial stability, you rely on a really solid clinical toolkit. We're talking psychiatric medication to rapidly bring down severe mania or psychosis. You provide a physically contained, safe environment. You've got nursing staff constantly monitoring, intervening before things escalate. Plus, you introduce vital evidence-based therapies like ACT, CBT, and DBT. And throughout all of this, you are constantly assessing and adjusting protocols. It's intense, it's demanding, but it's absolutely essential. Because without this baseline of safety, literally nothing else can happen. Which brings us to part 2, the limits of stabilization, or what happens beyond the ward. So the immediate danger has passed. The clinical goals have been met. But this brings up a really crucial question. A patient is stable, sure, but are they actually recovered? It's a question that highlights a pretty massive empathy gap between a medical endpoint and a patient's actual human reality. Think about it. On paper, a patient might be a total clinical success story. The boxes are checked, they aren't psychotic, they aren't suicidal, and they're taking their meds exactly as prescribed. But the human reality, it can be drastically different. Internally, that same stable patient might be going home to total isolation. They might be unemployed. They are almost certainly carrying heavy, lingering trauma from the episode itself. They often feel completely disconnected from the person they used to be and terrified of what the future holds. The clinical risk is managed, absolutely. But the human being, they might still be in pieces. And that leads us right into part 3, defining long-term recovery and mapping out what that journey really looks like. Here's where we see a huge shift in priorities. Treatment, out of sheer necessity, is highly targeted, right? You're relentlessly focused on symptoms, risk management, diagnoses, medications, and tracking those clinical outcomes. But recovery? Recovery demands a completely holistic focus. It's the messy, deeply human work of finding hope again. It's about making sense of the immense suffering they just went through. It's reconstructing a shattered identity, fixing damaged relationships, discovering a new purpose, and ultimately fighting for a decent quality of life. Treatment hits the medical metrics, but recovery, that's about rebuilding the human soul. Andrew Turtle sums this up perfectly. He says, "Treatment helped me survive the crisis. Recovery helped me build a life beyond it." From a patient's perspective, this is a huge realization for clinical staff. True recovery often begins the exact moment your formal treatment ends. You help them survive so they actually have the chance to build. Just look at the sheer scale of time required here. It's wild when you put it side by side. Treatment is usually this concentrated burst, a matter of weeks for hospital admission and stabilization. But recovery? Well, it takes months just to come to terms with the fact that the episode even happened, and to manage the inevitable post-crisis depression. And beyond that, it takes years, literally years, rebuilding basic confidence, slowly mending relationships, discovering new meaning. It's a massive undertaking. So while your direct involvement might only span those intensive weeks, knowing there's a years-long mountain ahead completely changes how you might prepare a patient for discharge. Okay, let's zoom in on that years phase in part 4, identity and self-determination, and how patients go about reclaiming their identity. So, what actually drives this long-term recovery? Unlike treatment, which is largely administered by you, the experts, recovery is incredibly active and entirely self-determined. You can't do this part for them. The patient has to do the heavy lifting. They're the ones rebuilding damaged relationships, processing their own trauma, and managing lingering depression. They have to actively explore their shifting values, rebuild their confidence step by step, and develop a completely new sense of identity. It's really hard work. But all that grueling work leads to a really crucial breakthrough. As Andrew puts it, recovery was where I discovered that I was more than my diagnosis. Honestly, if there's one big takeaway from this explainer today, it's this. True recovery is reclaiming your identity beyond a medical label. In the hospital, you absolutely need that diagnosis to treat them effectively. But out in the real world, they have to shed the totalizing weight of that label to become a fully realized person again. To see this in action, let's look at Andrew's actual path to finding meaning. Step 1 was reaching that clinical stabilization with staff like you in the hospital. But the next steps, those were all him. Step 2 was this deep personal exploration of his values to figure out who he was after the mania. Step 3 was a massive creative undertaking. He channeled all his trauma and insights into writing his books, The Dialectics of Mania and A Turtle's Journey. And Step 4 is ongoing, creating entirely new goals, new projects, a whole new direction for his life. Self-determination looks different for everyone, but for Andrew, finding his voice as an author was his ultimate milestone. Finally, let's bring it all together in Part 5, Bridging Treatment and Recovery, and look at how your acute care is the launching pad for their entire future. The hospital treated my mania. Writing helped me recover from it. I just love that quote. It perfectly captures how medicine and self-determination work together. The hospital provided the science, the safety, and the stabilization. The writing provided the soul, the purpose, and the identity. One tackles the illness, the other tackles the human being. Basically, it comes down to this. Treatment is the foundation, and recovery is the house the patient builds on top of it. And, the fact that holistic recovery takes years doesn't diminish the value of your acute treatment at all. Actually, it highlights just how vital it is. Your clinical care is that rock-solid, indispensable foundation. Without your acute care on the front lines, the patient literally never even makes it to the starting line of their long-term recovery journey. So, as we wrap up this explainer, I just want to say thank you for the foundational, life-saving work you do on the wards every single day. I'll leave you with this final thought to chew on as you head back to your clinics. Now that we've looked at the full, years-long timeline of a patient's lived experience, as clinicians, how can your acute treatment phase best prepare a patient to safely build their years of self-determination upon it? Think about it.